Hi Alphas, today we are going to break from our usual content to bring you a special episode. This episode will focus on the facts around the Wuhan Coronavirus. Do you need to be concerned? Yes. Do you need to be in a panic? Not yet. So, what is a coronavirus, you may ask? A coronavirus is a family of viruses that in humans cause a variety of respiratory tract infections. These range from the benign common cold all the way to the highly lethal SARS outbreak. The coronavirus gets its name from its shape when viewed under an electron microscope. It somewhat resembles the corona of the sun. We first discovered coronaviruses in the 1960s, and since then have not been able to find a cure or vaccine that is fully effective for any of this family. This is in part due to the highly mutagenic nature of these viruses. This explains why you can catch multiple colds in short succession, as the virus can bypass the immunity built up by your immune system from the last strain you caught. What is the deal with this Wuhan coronavirus then? Officially designated as 2019 nCoV. This infection is causing major concern around the globe due to multiple factors. These include the speed at which it is spreading, and the number of deaths it has caused in a short period of time. So, what do we know so far? Well, we know that the virus most likely started in the Wuhan seafood wholesale market. This was confirmed by PCR analysis of infected patients early in the outbreak, which identified a new strain of coronavirus. 2/3 of the infected had a link to the Wuhan seafood market. This market also dealt in the trade of live animals. These animals ranged from koalas to snakes. According to reports, these animals were kept in extremely poor conditions very close to humans in the market. These conditions involved extremely poor sanitary measures, and workers were regularly exposed to the feces and urine of these animals. This combination of close proximity and poor sanitation provided a perfect breeding site for a zoonosis, meaning spread of infection from an animal to a human. The current working hypothesis is that this coronavirus jumped from one of the animals in this market into a human who started the infection. We can refer to this person as patient 0. So how did this infection, which was in an animal previously, start infecting humans? We can look at two factors at play here, the proximity and the mutagenic rate of coronaviruses. In regard to the close proximity and poor sanitation, many animal viruses will have entered humans who worked near these animals. The vast majority of these will have had no effect, as the binding sites they use to infect will not function in the human cells. However, due to the high mutagenic rate of coronaviruses, it was only a matter of time before a mutation that can infect humans occurred. When this mutated coronavirus encountered our patient 0, which was highly likely considering the proximity, it was able to then go on to infect our patient 0 and replicate within their body. Following this infection, patient 0 was then able to move the infection out of the market and to others in the surrounding area, thereby starting the outbreak fully. So now that we have a background on how the infection started, what symptoms do you need to look out for? Most infections at present are showing symptoms similar to the flu or a bad cold. These include fever in 90% of infections, fatigue and dry cough in 80% of infections, and muscle aches and weakness in 44% of infections. Diarrhea was also reported in a small number of those infected. However, worryingly, the disease is showing serious signs in a significant number of the cases reported. These include breathing difficulties in 20% of cases and respiratory distress in 15% of cases. A currently unknown number of these serious cases go on to develop severe pneumonia, which is a life-threatening complication of this infection. Pneumonia is a collection of pus or fluid within the alveoli of the lungs. This can cause death rapidly via the same mechanism as drowning, however in this case the fluid is from within the lungs, not from an external source. Anyone showing severe respiratory distress such as fast breathing, chest pain or fast heart rate should summon medical aid without delay. These symptoms are based on the most up-to-date data at the time. However, due to the evolving nature of this outbreak, these symptoms could be updated at any time. Now that we know what the symptoms of the coronavirus are, how does it spread? Current research is indicating that the coronavirus is an airborne virus that primarily spreads via droplets. These droplets hold the virus suspended within them. These virus-laden droplets are spread whenever someone coughs or sneezes when they are infected with the coronavirus. This mechanism is similar to how the common cold or the flu spreads. The act of coughing or sneezing aerosolizes the mucus, which makes it airborne. This in turn enables the droplets to be inhaled by those close to the infected person. New research is suggesting that infection is even possible via droplets contacting the mucous membranes of the eyes. Following the entry of viral particles into the body, the virus adheres to respiratory cells via the ACE2 pathway in a similar fashion to the SARS virus. Once the virus is within the cells, it hijacks the mechanisms of cellular replication. It instructs the cell to create copies of itself before bursting the cell open. This releases numerous viral particles which can infect other cells, thereby continuing the cycle within the host. At present it is unknown how long the virus can survive outside of a host. As such, it is wise to treat all materials that an infected person may have encountered as infectious and avoid or disinfect them with appropriate precautions. New research is unfortunately showing that individuals can spread this disease before symptoms emerge, which would seriously hamper the current containment protocols. These protocols include quarantining sick patients and checking for fevers at airports. These measures are ineffective now, as those infected may spread the virus before showing any outward symptoms. Current research is indicating that an infected individual is capable of infecting 2 to 4 other individuals. It is also showing that transmission is viable in at least a chain of up to 4 individuals at present. This gives us R0 of somewhere between 2 and 4, which puts it around the same infectivity of SARS and higher than that of an average flu. This R0 figure is likely to change as the outbreak continues and further research is conducted into the infectivity of this coronavirus. With the provided R0 figures, we can see that this outbreak is likely to continue spreading at least within Wuhan. Some researchers are indicating that there will likely be over 250,000 cases by February 4th within Wuhan. This is based off the upper range of the R0 estimates. So now we know the symptoms of infection and how the virus spreads from person to person. How are we able to help protect ourselves from this infection? With the knowledge that this virus is airborne, we need to prevent ourselves from breathing in the aerosolized droplets from an infected individual. A simple and relatively effective method of this is to wear a mask to prevent this transfer. A simple dust mask will be ineffective, however, as the droplets can be small enough to pass through the filter. A suitable mask will need to be rated to at least an N95 rating, if not higher. This will provide a suitable barrier to droplets entering your respiratory system. If an outbreak is currently occurring within your country that is not an isolated case, the N95 mask should be the minimum protection you wear when traveling in public spaces and using public transport. A mask is only as good as the fit, however. Improper fitment will render your mask merely a poor fashion accessory, incapable of filtering the virus and leaving you open to infection. Ensure that you follow all instructions when fitting your mask. Seek a suitable instructional video for help with fitment of your mask if required. Once you are finished with your mask, you should treat it as infectious material. Dispose of it with the minimum of touching required, followed by effective hand washing. With the new research indicating that the virus can be spread through the mucous membranes of the eyes, it would be wise to double your gear up with either a full face mask rated to N95 specification or a set of airtight goggles to protect you from infection. These should be sterilized after use, and hand washing is essential after removing and handling your eye protection. As no research exists at present on the longevity of the virus outside of the host, you should assume your hands are infected as soon as you are in public. You should practice careful hand hygiene before eating or touching your face to help yourself not get infected. These precautions are only a guide, based on the current profile of the virus. This should not be taken as a guarantee that this will keep you safe from infection. You should adapt your precautions based on the current threat level in your area. The recommendations above would most likely be over the top if there is no reported cases within your area. At present, there are no current treatments available to cure coronavirus infection. Neither is there a vaccine available to protect people from becoming infected. Supportive care is provided to those in need. This can range from fluids due to dehydration, up to a stay in intensive care for those with pneumonia requiring artificial ventilation or ECMO support. Current research is looking at antiviral drugs already in production, such as Tamiflu, to see if these have any effect on the progress of the infection. However, as of today, nothing has been proved effective. Initial research is already underway regarding a vaccine. However, expect work to be slow regarding this, as vaccine production is typically a long process, which takes a significant amount of research to achieve. At present, the old saying of an ounce of prevention is worth a pound of curing's true. You should practice vigilance and invest in personal protective equipment if the situation demands it in your area. With the knowledge that we have gathered above, we are going to extrapolate a little here and look at the potential outcome if this virus becomes a global pandemic. With the R0 figure of between 2 to 4 and a case fatality rate of around 3% at present, this virus has the potential to be on the scale of the Spanish flu, which killed 50 to 100 million by current estimates if not tackled effectively and promptly. At present, only one young person has died as a result of this infection. The majority have been elderly or with comorbidities such as diabetes or pulmonary issues. However, this can change rapidly, so please keep an eye out for any changes in the current situation. I hope this helped you feel more knowledgeable around the subject, giving you the knowledge of what precautions you can undertake if the worst happens and this becomes a global pandemic. Please like, subscribe and leave a comment if you enjoyed. P.S. Rest in peace, Kobe.